Now we discuss the carbapenems. Carbapenem contain the beta-lactam ring, which is fused with a five-membered penem ring. Beta-lactam ring, which is fused with a five-membered penem ring, and hence the name carbapenem. Why carbapenem? Because beta-lactam ring fused with a five-membered penem ring. That's why the name carbapenem. And in that category, we have drugs like imipenem, meropenem, irtapenem, doripenem, and ferropenem. These are the different penems that we have. Most commonly used is the imipenem and meropenem. Then carbapenems, they are highly resistant to the most of the beta lactamases. They are highly resistant to the most of the beta lactamases, and the mechanism of action, they will inhibit the bacterial cell wall synthesis similar to the penicillin. The mechanism of action is similar to the penicillin by inhibiting the bacterial cell wall synthesis. Now we'll see the antibacterial spectrum. They show wide antibacterial spectrum and inhibit various gram-positive, gram-negative organisms. Spectrum is wider as compared to the other beta-lactam. They show wider antibacterial spectrum, means they can inhibit various gram-positive and gram-negative. Anaerobes including streptococci, staphylococci, enterococci, listeria, enterobacteriaceae, that includes cephalosporin resistant 1, Pseudomonas and Bacteroides fragilis. So we can say very wider antimicrobial spectrum. Particularly they are effective against anaerobes, very important, including streptococci, staphylococci, enterococci, listeria, enterobacteriaceae, including the cephalosporin resistant one. Means it is better and wider spectrum over the cephalosporin. It is also effective against Pseudomonas and Bacteroides fragilis. That are the advantages of these carbapenems. Now in that category, the most commonly used drug is the imipenem. Imipenem, it is not absorbed orally, so it is given intravenously, 250 to 500 milligram. Intravenously 250 to 500 milligram. Good tissue penetrability, and it achieves good CSF level. It is achieving very good level in the CSF and good tissue penetrability. These are the advantages. But the problem with the imipenem, it is quickly or it is inactivated by the enzyme dehydropeptidase in the renal tubule. In the renal tubule, it is inactivated by the dehydropeptidase. Hence, it is always combined with the cilastatin, which is an inhibitor of dehydropeptidase in order to prolong its plasma half-life. Means it is always given in combination imipenem cilastatin. Why? Because if it is given alone, it is inactivated by the enzyme dehydropeptidase in the renal tubule. So it is always combined with the cilastatin, which is an inhibitor of the enzyme dehydropeptidase. Plasma half-life of both imipenem and cilastatin is nearly 1 hour. The plasma half-life is similar. That's why we can combine. Carbapenems are excreted to the kidney, and dose should be reduced in the renal failure patients. Dose should be reduced in the renal failure patients. So where we can use this imipenem cilastatin? Imipenem cilastatin is used in the UTI, in the urinary tract infection, respiratory tract infection, skin and bone infection, soft tissue infection, intra-abdominal and gynecological infection due to susceptible microorganisms that are resistant to the other antibiotics. If they are resistant to the other antibiotics, you can treat with the imipenem cilastatin combination. Which are the antibiotics? Which are the infections? UTI, respiratory tract infection, skin and soft tissue infection, bone infection, intra-abdominal infection, gynecological infection, which are resistant to the other antibiotics. It is particularly useful in infection with the penicillin resistant pneumococci. Imipenem, it is effective against penicillin resistant pneumococci, and it is used with an aminoglycoside in Pseudomonas infection to reduce the risk of developing resistance. To reduce the emergence of resistance It is used in combination with the aminoglycoside in infections like Pseudomonas. Since Imipenem and other carbapenems are resistant to the beta-lactamases produced by Enterococci, it is a drug of choice in Enterobacter infection. It is the drug of choice for Enterobacter infection. Why? Because Imipenem and other carbapenems are resistant to the beta-lactamases produced by Enterococci, and that's why it is the drug of choice for Enterobacter infection. Then the next drug in that category is the Meropenem. Meropenem, it has the following advantages over the Imipenem. It is not destroyed by the renal dehydropeptidase or dipeptidase. So it is not required to combine with the cilastatin. No need to combine with the cilastatin, which is a dehydropeptidase inhibitor, because it is not destroyed by the renal dipeptidase or dehydropeptidase, and risk of seizure is less with the Imipenem. Risk of seizure is less than with the Imipenem. Meropenem, there is less risk of seizures. Indications of Meropenem are similar to the Imipenem. So these are the Imipenems that we have discussed.